Hi, my name's Cheryl Gowland. I am Digital and Transformation Lead for Doncaster North Primary Care Network. Doncaster North PCN is a collaboration of 10 GP practices, and we have almost 80,000 patients on our list, so it's quite a big PCN. What I want to cover off for the next few minutes is a little bit about me and the work that I do as D&T lead, a little bit about the role of D&T lead or PCN manager, the context that we're working within as PCN staff, the importance of PCN and practice manager relationships. So a little bit about me. I'm married with 2 grown-up boys. I live in Doncaster and have done for most of my life. I've worked in the NHS for over 30 years and I've worked in primary care for just over 3 years. So the context that I find myself working within is there are often different levels of engagement, different levels of understanding, particularly of the PCN and what the PCN is there to do, different motivations, sometimes a long-standing history between some practices. Practices all have different priorities, sometimes a lack of time or capacity. Practices you'll find are often still working as individual businesses. They have different needs and wants. Quite often things feel like that it's something new or like it's already been tried before. Practices are really stressed at the moment, so workload pressures are really high. Lots of different personalities we're working with. Sometimes there's no clear direction, or on the other hand, you can feel like you're a little bit micromanaged. There's a limited understanding of the D&T lead or the PCN manager role, but then likewise there's sometimes a limited understanding from PCN managers of what life is really like in practice day to day. It's a case of multiple businesses coming together who probably wouldn't if they had the choice. In Doncaster North PCN, we're based on a locality footprint. So all our 10 practices are working across the North locality. So what does a D&T lead do or a PCN manager do on a day-to-day basis? It's a really varied role, really diverse. Sometimes we can be working on HR or organisational development. We can be managing clinical services, managing large-scale events. So, for example, in our PCN, we facilitate a quarterly PCN development session, but we also, in addition to that, facilitate a practice staff development session. We can be facilitating discussions between the PCN and practices or between stakeholders, financial management, business and workforce planning, chairing board and operational meetings, a lot of reporting and monitoring, particularly across our practices. Marketing, comms and engagement can feature both internally and externally. Always striving for quality improvement, managing projects and contractual requirements. There can be an element of patient engagement and ensuring that our IT infrastructure is in place as well. Some of the challenges I find in my role as D&T lead or PCN manager is it can sometimes be quite a lonely role. Sometimes you don't know if you're doing a good job or not. The practices don't always agree with what you're suggesting or what you feel is best for the PCN. Sometimes I feel like I'm just left to get on with things, and sometimes the role isn't always recognised or valued. So I've been enrolled now in this PCN, this is my second PCN. I've been with North for around 20 months now. I arrived a couple of months after our clinical director was elected. And from there, we've just gone from strength to strength, really. We've spent a lot of time and effort on organisational development, putting our strategy in place, developing a mission for our PCN. One of our biggest celebrations, really, or things to be really proud of, is the Enhanced Access Service in October 2022. We were the only PCN in Doncaster who decided to run that service ourselves and not subcontract it to our local federation. And it's been a real success and something that we really use as our pivotal example on which to build on our successes. Last month, we saw the appointment of our 2 new clinical directors. It's a joint role. Both those clinical directors have had limited involvement in the PCN previously. So over the coming months, we'll be working lots around how we improve their knowledge of the PCN and really build relationships with our PCN member practices. So just a little bit about our additional roles reimbursement scheme. We spend all of our ARRS budget year on year for a mixture of both clinical and non-clinical roles. So our clinical team are made up of pharmacists and pharmacy technicians, dietitians, podiatrists, mental health practitioners, and working alongside those are some of our non-clinical roles in what we call our personalised care team. So that team comprises of care coordinators, health and wellbeing coaches and social prescribers. They provide a holistic, multidisciplinary team approach for the benefit of our patients in North. So that's my role in a nutshell. You can contact me outside of this on cheryl.gowland@nhs.net. Thanks.